Exciting news! As of May 13th, we can extend Pfizer vaccination to 12 to 15-year-olds based on FDA emergency use authorization extension last week and the ACIP recommendation on May 12th. This is important because we are seeing that as vaccination of older age groups progressed, a higher percentage of COVID-19 cases across the country were in pediatric patients. We also learned that co-administration of COVID-19 vaccines with other routine adolescent vaccines is now allowed without regard to timing. This includes simultaneous administration of COVID-19 and other vaccines on the same day, as well as co-administration within 14 days. Adolescent vaccination has fallen way behind during this pandemic. Tdap is down almost 19%, HPV is down 19.3%, and meningococcal conjugate vaccine is down 15%. We can turn this around, catch adolescents up, and protect them from COVID-19 all in one visit. I'm so excited about it, I wore what my kids call my Big Bird shirt today. Not surprisingly, parents and adolescents are most comfortable getting COVID vaccine in their primary care provider's office. And this is from a CDC University of Iowa survey in April of 2021. They're more comfortable there than in pharmacies and school-located vaccination centers combined. So let's not make any mistakes, like we did with the HPV vaccine rollout, in terms of presuming that parents are uncomfortable with COVID vaccination or just don't want to talk about it. Make a strong presumptive recommendation for all of the adolescent vaccines in one breath. Like, Mike is going to get Tdap, HPV, COVID, and meningococcal vaccine today. I'm so excited to protect him from pertussis, cancer, COVID, and meningitis. Let's get this done. Notice how I sandwiched HPV and COVID in the middle of that list? That's an evidence-based way of not setting HPV and COVID vaccine apart from the other recommended adolescent vaccines. If parents want to know more about Pfizer or ask you what you think, be honest. Tell them if your kids have already gotten it, or if any kids of the MAs, RNs, or the front desk staff have gotten it. Have a personal testimony available, like, I can't wait to give it to my kids so they can go to camp, or my son already got it, and besides some arm soreness and tiredness for a day or two, he feels great. Tell them it was 100% effective in preventing COVID in a study of over 1,000 kids 12 to 15 years old, with minimal side effects besides fever, fatigue, headache, and arm soreness. You could say the side effects are certainly worth it to get your kid back to what they love. If the parent hasn't been vaccinated yet, please remember to offer it to them too, to set a good example, or just because it's convenient and they trust you. You won't be penalized for reporting an increased number of unused doses and vials, so just give vaccine, even if it means puncturing a new vial for one dose. There are lots of new CDC resources for parents and healthcare providers about vaccinating teens for COVID. And if you have specific questions about tough patients, feel free to contact the Clinical Immunization Safety Assessment, or CISA, COVID Vax project at the website shown here. Please refresh yourself and your staff about unaccompanied or emancipated minors seeking care with the definition shown here. They need documentation and adequate counseling prior to vaccination, but we should make every effort to get them vaccinated. Now that the Pfizer age range has expanded, you might be finding yourself storing Pfizer vaccine for the first time in your outpatient clinic. You can order in dose increments of 6, and we will try to break the boxes to deliver your desired amount. Remember that undiluted Pfizer can be stored in a pharmaceutical freezer between -25 and -15 degrees Celsius for up to 2 weeks. And while the FDA has submitted data to CDC to get approval for refrigerated storage for up to a month, currently it can only be kept in the fridge between 2 and 8 degrees Celsius for 5 days. So don't move the vials from the freezer to the fridge until you're ready to use them in the next 1 to 3 days. Undiluted vials should spend no more than 2 hours at room temperature, but diluted vials can last for 6 hours at 2 to 25 degrees Celsius. In terms of post-administration observation, You want to observe patients for at least 15 minutes after administration and report any adverse events to the VAERS system. Individuals with a history of anaphylaxis due to any cause or a history of immediate allergic reaction of any severity to a vaccine or injectable therapy need 30-minute observation periods. Remember to provide an immunization record to the parents and patients and encourage them to take a picture of the card on their phone. Make a second dose appointment before they leave. This is an evidence-based strategy to improve series completion. Doses should be separated by at least 21 days, so have them set a reminder on their phone. Remind patients after their first dose to continue the 3 Ws: wearing a mask, washing their hands, and watching their distance, until 2 weeks after their second dose. This is new CDC guidance from May 13th and may help to encourage some patients to get vaccinated. Of course, good hand hygiene and good decisions are always recommended. Thank you for everything you do to get Chicago's families vaccinated. See you next week.